Aika kirore nyarete sengo ajumo dori. Aika kirore tomana kanyangon. Do ajata do kanade kanese.
Baylor Uganda was a prime recipient of a 5-year grant that started from October 2010 to September 2015 with an extension to March 2016 for Arua and June 2017 for Soroti regions. The project was titled Scaling Up Comprehensive HIV/AIDS Services, including provider-initiated testing and counseling, TB/HIV, OVC, care and ART for adults and children in Eastern and West Nile regions in the Republic of Uganda under the President's Emergency Plan for AIDS Relief (PEPFAR). The project aimed at contributing to the achievement of the national HIV prevention goal of reducing new HIV infections by 40% by the year 2020.
When Baylor came, we had a number of challenges. Most of the challenges were related to poor performance, lack of equipment, lack of infrastructural development, and all those challenges, when Baylor came in play, had to be put right.
Baylor Uganda set out to support project districts to increase adoption of safe sex behavior and HIV transmission risk reduction, expand the access to and use of biomedical prevention interventions, mitigate socio-cultural and structural drivers of HIV, reach a more coordinated HIV prevention response, and strengthen information systems for HIV prevention at all levels.
We started off by ensuring that people understand the policy changes, especially the health workers. And we mainly targeted the midwife and the nurses that support maternal and child health services at the facilities that we engaged.
There were moments that were hard, but the kind of person I am, I believe every challenge is an opportunity. It took a little time to get West Nile staff on board because this was the first time ever for West Nile region to have a private, not-for-profit service. And it took people to really get convinced that they can go and work in West Nile.
Baylor built our capacity in management of HIV, and they was able to supply us with SOPs and guidelines in management of HIV, was updating our knowledge on the new issues concerning HIV, because HIV being dynamic, things keep on changing.
They have built capacity into us. Previously, we never had knowledge in this. They trained us. Personally, I'm an Eastern regional trainer in adolescent HIV care and treatment.
Training and mentorship were conducted for 1,663 health professionals and 1,093 village health teams. The project served a population of 1,872,600 in Soroti and 2,731,100 in Arua regions.
Sekibero kau eringa mukia na lopete takanona utarake da lagruna polonoi wala mukia arara mukia ikamu ye muso ya malaria kwaeni right osom sirigin ametike Alexana Uganda.
Previously, those who started earlier, they were getting drugs from Kampala. Then later on from regional referral hospital Arua. But I am the lucky person, I started from Arua, but they referred me to Nyapea. When Baylor came in, They brought us the drug just at our health facility at our health center 3. It was Baylor.
And after every 6 months, they would take our samples for CD4. They go and test and bring us the results. We see how we are progressing. The things were okay.
The number of patients in HIV care increased by 66% to 47,171, and those on ART increased by 82%. Over 200,000 men were circumcised, and over 4,500 OVCs were served and graduated from vulnerability.
Previously, when the facility started offering HIV care, we used to transport samples up to Atutur Health Center, a hospital that is in Kumi, and we would receive results after 2-3 weeks, 1 month. So as Baylor gained more ground, we were able to get a PIMA machine within, which we were using to monitor patients who are on HIV care.
There are people who were able to access ART services more easily, because when Baylor came in, there were only 3 ART sites in Yumbe. But we worked with the Baylor staff, we were able to accredit 7 more. Currently we have 10, so people are able to access ART services in a short distance.
It also went ahead to create confidence in the public, especially in getting health service delivery in government health facilities.
You can see with the refugee influx, if Baylor didn't come in, we will not manage. But because of that, now you can see we can accommodate even the refugees and also the community benefiting around. This is a great work that we have seen from Baylor Uganda.
The art clinic that was dilapidated, and it was almost an obsolete structure that we had left. But when we raised it as a concern to Baylor, they were able to take it up, and they did the refurbishment. And as we speak now, the same structure is being used by 2 departments, one being the art clinic, and then the other one is antenatal care department.
SMC waste specifically is directed to be burnt through the incinerator. So we used to transport it to Soroti Regional Referral Hospital. So now we don't have that challenge, we do it within our facility.
We have the incinerator in the facility. So this one has changed a lot. It has even made the community around the facilities much safer now.
9 laboratories, 7 HIV clinics, and 2 surgical theaters were refurbished and equipped.
Baylor carried some community family empowerment, where we train a number of beneficiaries, among us the caregivers. And these caregivers were put into VSLA groups, which Baylor supported in one way or the other.
Sele munisa opona yangare say training a otem para shakanyuni. Ada one training a say training on la para shakanyuni. Ati anakente sala wensa no agare mono grupun. So nepene no korak nete say maido keda mereke kin keda kine kede mele kule mongin mele kesiare. So di doe adumne nete angini karita boy anwa shoman.
They were able to buy mattresses for their children, improve the household items and properties because of the VSLA's activities that the program came and supported the caregivers of these children.
District health work plans were funded up to $936,846 annually through sub-grants.
Monitoring and evaluation has been key in this project. We had an overall monitoring and evaluation manager, and for each cluster, we brought in a monitoring and evaluation officer. We also supported the health facilities at the lower level to be able to have data entry, data clerks, but we also trained the biostatisticians, the DHT to be able to appreciate data.
Bubela isiana kesio, ale mono ni kota le report. Buda kwa na ija kesio aperianu tongien. Na da kwa ni jare taso da ija kinesi ale mono ni reportin. Konye do ile mi se reportin otomo joko na ara bubela dauta training asio.
Every year we had planning sessions with Baylor. We would review and plan together. And so the district was not left behind, unlike other projects where things are pushed onto the district.
We worked very strongly with the DHO's office, and we also worked very strongly with community structures. So those helped us achieve our targets and also move a long way in terms of implementation of the new policy.
The project had a goal to reduce HIV transmission and improve care for persons living with TB/HIV in Eastern and West Nile districts of the Republic of Uganda. Arua, 37% from 4.9% to 3.1%, and Soroti, 30% from 5.3% to 3.7%, registered the highest decline in HIV prevalence in Uganda during the project period, according to the Uganda Populated-Based HIV Impact Assessment Fact Sheet for 2016. Clients accessing HIV testing services increased to 89% in Soroti and 83% in Arua. Over 100,000 pregnant and lactating mothers received PMTCT services annually, with 94% of the HIV positive receiving antiretroviral treatment. Transmission of HIV from mother to children reduced 13% to 3.6% in Soroti region and from 18% to 4.9% in West Nile region.
Apupi nga yala mani pola no akira no abube la ngara kinango obo na kingekia abu ijai kadue osedi kwana gaona no kanwa kikadwa koto dumunu bengale ti duwe mamene deka so da kora kinika ko kidopeta kineda ko kwana jai donge joko te da kine ko kuda e yala madonga pupi donga yala mataita.
Tungalo bele ngala kisiso noi araisi tungala kuriaka konye nilo so training apod sa bongta ngena kachutno ne ngabwenga bonga ngena mama kurian masoda nglener kade katunga kade edwengu didikangun be esubalu tete so da kwana de kaso konye ilikota si dikusikie jog mami palutos ailikikie.
As I speak, I am actually a national trainer as well as a national mentor in the area of HIV. Not because of myself, but because of Baylor, how much they impacted in me and us as the staffs of Princess Diana.
The knowledge that we have got, even though Baylor has gone away, but we have remained with the knowledge, and it is helping us to address so many gaps in the facilities.
First and foremost, I want to thank Center for Disease Control Uganda, who through PEPFAR have made us be able to deliver the services that we have delivered to close to 8.5 million people, both in Eastern and Western Nile region.
Wakati ya Bella anaita kufundisha sisi namna tutachunga watoto, namna pia kuchunga mtoto wako, namna wewe mwenyewe na meza dawa, namna pia mtoto unampatia dawa, kuenda kupima yeye amisho, akasema ugonjwa hakuna kwa mwili yake. Nikafurahi.
Sari si ini alanda school mo si class suga. Dora ini risi aleta doma antinga badruki do ama dilega school sendani.
Me as personally, they link me, the advice they link me to the community, because I was just stigmatized in the community, because they used to have sensitizations. At one time when they have sensitization in my community, up to now, my community are full in support of me. up to now as I talk, even if you go around here, I tell them something is like this, I need help, they are willingly, because they know that we are to be supported, and that was all support from where? From Baylor.
Thank you, CDC.